my name is Dr. Koheli Bhattacharya and today we will be covering the allergic eye disease. Now a lot of our patients come with allergies and many of them are children. Many of them have their first allergy maybe at the age of 1.5 or 3 years. And so this is a very important topic and I thought I should cover it for my patients. So in today's video we are going to cover what is the difference between allergic eye disease and sore eyes. Then the next thing is what are your common symptoms and signs of allergic eye disease, how to prevent allergic eye disease and how to treat it, and finally what you should completely avoid doing in these conditions, and also about the itch rub itch cycle. So let's get into it. So the first thing is, what is the difference between allergic eye disease and sore eyes? Now sore eyes or pink eyes is generally contagious bacterial or viral conjunctivitis. So this spreads to others. This is something that leaves your eyes very sticky in the mornings. So one of the major differences between allergic eye disease and sore eyes is that allergic eye disease generally gets worse by the day. Right? By afternoon, evening, you're rubbing your eyes more. By evening, by night, you are really rubbing your eyes, right? In the mornings, you're fairly okay when you wake up. While in contagious eye conjunctivitis, you get up in the morning with your eyes stuck or watery or red, and it's the worst in the morning, and as the day goes by it starts to clear up because your eyes are open and there is less of the stickiness and all. So that is one of the really simple ways of knowing what you have. The other thing is, of course, the other signs like, are you rubbing your eyes too much? Is the itching unbearable? So there might be some amount of itching in sore eyes, but not the unbearable kinds, right? And the other things which would be where is the redness? If the redness is more in the pink part and more in, from the outside in, then it is more sore eyes, and if it's from inside out, it is mostly allergic. But again, that is something that mostly your doctor will be able to pick up. So what you want to see is when is it happening and is there too much itching. So why do we need to make the difference between allergic eye disease and sore eyes? Now again, allergic eye disease is something that you put the drops, it feels good. The minute you stop the drops, after a few days, it again starts, right? So a bacterial or viral conjunctivitis generally will not have this kind of, the minute you stop the drops, it comes back. Why do we need to make this differentiation between allergic and contagious conjunctivitis? One thing is use of antibiotics. We generally never use antibiotics in a case of allergic conjunctivitis, especially chronic conjunctivitis. We will never use long-term antibiotics in those cases, right? So that is one major reason why you want to know that is it bacterial or viral or allergic, right? So the difference between sore eyes and allergic conjunctivitis. The next thing is the common signs. Now what is symptoms? Symptoms is what the patient comes with, what you are experiencing. So that could be itching of the eyes, sneezing, watering of the eyes, redness of the eyes when you have played in the dust or gone swimming, or too much watering of the eyes, or a white kind of circular thing which you have seen. Right? Now what are signs? Signs are what the doctor sees, right? Signs are things that we see in your eyes when you get allergic conjunctivitis. Of course, you can also see them after I have explained to them today. So symptoms are things that are happening to you, watering, redness and all of that. So what are the signs? One of them is called the cobblestone giant papillae. Now where is this seen? This is seen on the underside of your upper eyelid, okay? So many a time we will turn the upper eyelid. You might have seen me struggling to, turn the eyelid, and many a time parents would be like, but why are you doing this? That is because we are looking for these giant papillae which are only present in allergic conjunctivitis. Of course, there is a different form of follicles which are seen in sore eyes. So the follicles are more dot type and yellowish kind of, while the papillae are more like bigger and more reddish, like velvety, right? So giant papillae are seen in allergic conjunctivitis, another way that we differentiate sore eyes and allergic conjunctivitis. The next is the Horner Tata spots. This a lot of patients will be able to notice. This is around the iris, around this black part, along the cornea, there would be a raised amount of white, like something that is stuck over there. Like it feels like it's a white layer, or like it has a little bit of a raisedness, and you could also see little bubbles of white. So these are called Horner-Tranta spots. Now how does this happen? As all of the blood supply comes and has to stop at the cornea, because it can't go into the cornea. Cornea is bloodless or does not have any blood vessels. So you might over there see a lot of eosinophil deposits. Now what are eosinophils? Eosinophils are something that is released during allergies in all of your body, right? It's in the bloodstream. So the deposition of those eosinophils is what we see as Horner-Tranta spots. The minute we see Horner-Tranta spots, that means that this allergic conjunctivitis has been for a long time. It is a chronic case. They have been having this for months on end, for weeks on end, and now it is time to go into preventive medicines for them, right? So the different kind of medicines depends on if we see giant papillae and Horner-Tranta spots, and it's not just a simple case of little bit of allergies, right? The next thing is a shield ulcer. Now how does a shield ulcer happen? Because of these giant papillae rubbing against the cornea, there could be a very slight, whitening of the cornea, which leads to the shield ulcer. Now, these can be sight-threatening if they are left untreated, because you may lose vision. Maybe that scar remains always on your cornea even after we've treated the allergic eye disease. That is why we need to treat all of these really vigorously, right? We should not, and you might see people on the road with, these really, whitish thing around the eyes. If you see them, and you can ask them that, are you taking treatment for allergic eye disease? Because it must not be there. It must be treated on time, right? Because otherwise they just leave long-term sequelae. The next thing is prevention and treatment. Now, who deserves prevention? Who deserves treatment? If it's your first time you're having allergic eye disease, this is the first time that you went somewhere, something allergy came into your eyes, you rubbed it, and for a few days you're just rubbing your eyes. Maybe you are painting your house, or some dust is there in the house, and you just have one bout of allergic eye disease. We will give you the treatment for allergic eye disease, which could last anything from 5 to 7 days, and which will be some kind of mild steroids, and which will settle the condition. And these mild steroids are surface steroids, meaning they don't enter the eye. That means they are nothing like dexamethasone or prednisolone. No, we do not write these. These medicines should not be taken for plain allergic eye disease. Allergies are on the surface of the eye. They are not inside the eye. They are not affecting the lens or the inside iris or any of that. This is only on the surface of the eye, which affects only the conjunctiva. So we give surface steroids like loteprednol or a certain few other combinations which are surface steroids, right? So that would be around 5 to 7 days. Now, who needs prevention? Prevention is that, okay, we treat this 5 to 7 days, but we know that the minute we stop the medicine, the allergies will come back again. How do we know that? We know that because of all the signs that we see, the giant papillae, the Horner-Tranta spots, and also from the history that this keeps happening month after month, week after month. In these conditions, we cannot only leave it at treatment, right? We need to prevent it again. Otherwise, the flare will happen, you treat it, again it comes down, and then after a few days, again a flare happens. Now, how many times can you keep giving steroids, right? Even if they are mild and even if they are surface steroids, we want to keep you at a level where you are controlled throughout the year. Right? So in these conditions, we give you preventers. Now, the preventers can be oral preventers, they can be ointment preventers, they can be drops as preventers, or ointments as preventers, or injectables as preventers. So let's go a little bit into it. So oral preventers could be anything like oral mast cell stabilizers. This is especially given to patients who have atopy, who have atopic dermatitis, who have asthma, who have allergic rhinitis, meaning they just have allergens in their body. So maybe some doctor would have already started them on mast cell stabilizers or some kind of antihistaminics, something long term, especially anything which lasts for 2 to 3 months, right? And they are taking these tablets every day, irrespective of allergy or not. The thing with preventive medicine is that you have to put the medicine every single day, even if you do not have any signs or symptoms of allergy in your eye. So we will give something which has a mix of say olopatadine or ceftazidime or any kind of mast cell stabilizers inside the eye as eye drops, or many more are there which we will give as preventers, right? So we are putting those drops every single day to maintain a level of stability of the allergy. So you are not having allergic, big peaks in the eye, right? But even the minute you stop them, the allergy comes back. So we keep you on a baseline preventer. There are also preventers in the form of ointments, like loteprednol also comes in the form of ointments. We prefer these at night, especially because overnight people will itch their eyes a lot at night. So we have tacrolimus ointments which are put over the eyelid and around the eyes so that there is less itching throughout the night. And these are not put inside the eyes, these are put on the surface or on the eyelid from outside. So a lot of preventers are there. Speak to your doctor. We have like a huge variety of preventers for the eye. And the way I like to treat it is that step by step I will add one preventer and one kind of treatment medicine. Later we will add 2 treatment medicines and 2 preventers, maybe 3 preventers, and give you a combination of oral preventers, eye drop preventers, ointment preventers, and treatment medicine which you put once a week, treatment medicine which you put once a day. So many combinations can be done so that the eye is quiet, right? The next thing which is very important is also to check the glasses number. These children have a tendency to have astigmatic number. They also do have spectacle numbers which may be unrelated to their allergies. But yes, they do tend to have higher astigmatism. So treating of that is important. The next thing is wearing glasses. A lot of parents want to wear those preventive glasses so that the dust does not enter the eye. For this, you should get those sports kind of glasses so that the dust does not enter from the side. It may be important, especially in class, those where you use chalk dusters. These days, of course, we have dustless dusters or dustless chalk, which has really reduced the allergies. Other thing is maybe they get allergies from pollen, maybe they get allergies from grass, maybe going outdoors in certain areas. But we don't want our children to not go out to play or not enjoy these things. So in these kind of conditions, when there's going to be a lot of sports and there's going to be a lot of dust and a lot of grass flying around, they can wear those sport goggles which will prevent allergies from going inside the eye. But they should be tight because otherwise the dust and thing can enter the eyes. Now let's just discuss about the itch, rub, itch cycle. Now what is the itch, rub, itch cycle? Say you have a ant bite. Okay, when the ant bites, immediately if you just put some ice or if you just cover it with some cold wet wipe, you will see that the sensation passes away and it may leave a small red wheal, right? But if you go in and start to rub it, what happens? You want to rub it more and more, and there comes a time when you are rubbing it so much that it swells up. The entire area is swollen. So this is exactly how itch, rub, itch happens in any part of your body where there is a allergy or a reaction. What happens is when the minute you have the allergen, you feel the need to itch. This is because of the release of some histamines, right? And these histamines are within these mast cells. Now what happens is that when you rub it, right, you felt the need to itch and you rubbed it. When you rubbed it, the more of the mast cells inside the blood vessels you break the mast cells and more of the histamine gets released. Now more of the eosinophils come over there, more of the anti-allergy or the body's own defense mechanism comes there, more of the plasma starts to leak out of the blood vessels, and soon you have a swelling. So it's the same cycle inside the eye. The more you rub, the more you want to itch, the more you itch, the more you want to rub, and this itch rub itch cycle makes the eye redder, the corner tranta spots more, and it just increases this reaction. So all of these preventive medicines is to break this itch rub itch cycle. Can you also break it without medicines? Yes, you can prevent yourself from rubbing your eyes by quickly putting a cold pack on the eye when you feel the need to itch, or you can use a cold towel, a towel which is with cold water on your eyes, closed eyes. You're not splashing water inside your eyes. Remember, you're not splashing water inside your eyes, you're just keeping it on the eyelid to prevent yourself from itching. Again, another thing, you don't want to splash water inside your eyes. Nothing is going to happen by splashing the water inside your eyes. It will not clear up any of the symptoms or signs, and what you really need is the medicine to stay in the eyes. So I will not recommend washing your eyes too frequently when you have allergic eye diseases. The next thing is what things to avoid if you have allergic eye diseases. The first thing is long-term antibiotics. This is not an infection. So putting long-term antibiotics in the eye is going to make your eyes resistant to antibiotics, and say you have some kind of conjunctivitis later on, those medicines will not work. The next thing is oral steroids. A lot of people somehow take oral steroids like dexamethasones and all orally, not required at all. Oral antihistaminics or oral mast cell stabilizers are fine, but you don't need to take oral steroids for allergic eye disease, especially if it's manageable, right? We have such good, really strong steroids which act locally on the eye. You don't need to take oral steroids. The next thing is DEXA steroids, dexamethasone or prednisolone steroids in the eye. So any eye drops which has the letters DX, please don't use it for allergic eye diseases. Those are for cataracts or glaucoma or any kind of surgical treatment which we have done inside the eye. The next is over-the-counter medicines which contain menthol and camphor. Very commonly we will see this, that we will have patients who are using iCool, Iboric or something of that sort, which will have menthol and camphor in it. They are like taking Vicks for a sore throat. Immediately you might feel like, this really worked for me, but if the reaction comes back stronger and you are really not treating the underlying allergy. And over time, if you use too much of menthol and camphor, they narrow down the blood vessels and can cause more harm than good, right? So don't use those. And the last thing is stop your medication, because allergic eye disease is a chronic condition. It takes many years to control. Right, so many a time what happens is that patients will start the medicines, and then after seeing good result for like 2-3 months, they will stop everything, and then after 3-4 months again start. So this kind of stop actually does more harm to the environment, the immunity of the eyes, and that is why we don't want to do that. We want to keep on some kind of maintenance drops, maintenance preventers throughout for maybe 2, 3, 4 years, and rather than have this kind of stop treatment of allergic eye disease. I hope this has given you a good overview of what is allergic eye disease, and if you have any more questions, leave it in the comments below. Yes, one last question which a lot of parents ask is, why did this happen to my child? And really it is, why do allergies just happen to people? It could be because of immunity, it could be because they have low immunity, low vitamin D levels, low more allergies in their body. So maybe we'll test for vitamin D, maybe we'll test for parasites, we'll give anti-parasite medicine. But many a time allergies just are a part of growing up, and we see that these allergic eye diseases, yes, happen very commonly in childhood, yes, happen very commonly to boys, but they do outgrow this by the age of 12 to 18 years. So it's just about maintaining good eye immunity and anti-allergens until that age, and then it starts to settle down as they grow up. So nothing to be worried about. That's the other thing. What to eat, what not to eat. They can eat absolutely everything. Most of these allergens are not food allergens. Most of these allergens are environment allergens. It could be a perfume, it could be just dust, it could be pollen, it could be grass. So really you can't avoid that, and generally patients will not have food allergies which are causing these allergic eye diseases. But of course, if you have some kind of food allergy, do avoid that food. So thank you for watching. Share this, and if you have any more questions, leave them in the comments below.